Hello, I'm Danielle Knafo, and I'm a professor in the Clinical Psychology Doctoral Program at Long Island University at the CW Post campus. I'm also the chair of the SPIMI concentration, the Serious and Persistent Mental Illness concentration. We call it SPIMI for short, and I'm here to tell you a little bit about it. First of all, the SPIMI concentration is one of the 3 concentrations that we offer at Long Island University, and I'm very excited about this concentration, and I'd like to tell you about it. First of all, it fits in with the mission of our program, which is to train our students to serve the underserved. And certainly working with severe psychopathology is one way that that clinicians and psychologists can learn to serve the underserved. So basically, this concentration trains our students in the understanding and the treatment of severe psychopathology. In this era of psychopharmacology and managed care, we rarely encounter an approach to severe psychopathology involving empathic understanding, comprehension of symptoms, and intensive psychotherapy. We are one of the only, perhaps the only program in the United States that offers this type of specialty training. So, what is SPIMI? Who are the SPIMI diagnostic categories? Well, basically what it covers are psychoses, including schizophrenia, thought disorders. It covers severe mood disorders, bipolar illness. It covers severe personality disorders, borderline personality disorder, narcissistic personality disorder, schizoid, antisocial personality disorders. It covers trauma, serious trauma that might have been caused by sexual abuse, by war, by terrorism-related events. It covers substance abuse, sexual aberrations, and also eating disorders. So you can see that it's quite a range of categories that we cover in this particular concentration. The aims of the SPIMI concentration are several. First, we would like our students to gain a thorough understanding of the etiology, symptoms, theories of psychopathology, and varied approaches to the treatment of these disorders. We would like our students to become familiarized with the most up-to-date and cutting-edge research in the field, including psychosocial, neuropsychological, and phenomenological research. We very much want our students to develop a humane, non-judgmental approach to those who suffer from severe or chronic mental illness. We do not emphasize a disease approach, but rather a humanistic approach. We want to encourage our students to engage in research and education that will promote an advanced understanding of these populations. We want to facilitate an integration of psychological work with that of other disciplines, both in research and in practice. And we want to prepare our students to develop an expertise in the field of severe psychopathology that can be applied in education, research, or practice in hospitals, in courts, in clinics, and in private practice. So we're very ambitious. There are 2 elective courses in the SPIMI concentration. The first course is the theory and research course, which of course covers some of the things I just mentioned, the contemporary understanding of serious mental illness, the research, public policies, etc. The second course is the clinical applications course, which I teach, and it's a very hands-on clinical course. Students from the third and fourth years are already in externship, doing their externships, and therefore it's a wonderful opportunity to train them and teach them in therapeutic methods to work with these populations, and they bring examples of challenges that they encounter in these settings to the classes, and we as a group work together to understand and to think about ways of intervening therapeutically in these settings. We have concentration meetings every semester, and in these meetings we invite experts in the field to share their knowledge with us, and we've had the fortune to have some very wonderful speakers who have helped us understand a lot of things about this area of expertise. One of the things that I've done is also to invite people who suffer or who have suffered from serious psychopathology, and they share with us their experiences of the illness and also of the mental health system. So they are in a very good position to tell us what helped and what didn't help. And so that's very useful. Externships and internships. Naturally, in the third and fourth year, our students go out to find externships. The second year, they're in our clinic. Sometimes even in the clinic, they have SPIMI patients, but usually in their third and fourth year externships, they can find placements that will expose them to this population and give them further experience in the training. Inpatient, outpatient, day treatment, partial hospitalizations, clinics, VA hospitals, and more. The internship settings are similar. If our students wish, they can find hospitals where they get extensive and intensive training in working with the SPIMI population. Our students can write their dissertations on a subject that's related to serious psychopathology, and we invite that. It's not necessary, it's not required, but several of our students do choose to do that, and we have some wonderful dissertations in this area. You can check our website. I think we have examples of a few of them. So in conclusion, I just want to say that working with serious psychopathology, getting trained to do this work, is really working at the limits of human experience. And I've always found this very exciting. It's challenging, but it's also creative and growth producing, not only for the patients, but also for the therapists. Our approach here emphasizes the meaning making of the symptoms that patients develop. It emphasizes very much the therapeutic relationship as a healing relationship. And so many people in this field and out consider some of the individuals that we study to be untreatable, and this is unfortunate. First of all, the research shows otherwise. Courtney Harding's wonderful long-term longitudinal 30-year studies show that most schizophrenics recover, and we can be part of that recovery, and that can be very exciting. So for those of us who are willing to meet this challenge and do this amazing work, we can find that not only the growth is that of the patients, but also of our own. I tell my students that if they can work with this population, they can work with anybody. and I think that there's a lot of truth in that. So I hope I've interested you in our program and in this particular concentration. I would invite you to check out our website, and if you have any questions or would like to dialogue with me about the serious and persistent mental illness concentration, please email me, and I'll be glad to have a conversation with you. Thank you.